Well, nobody went IPO this week. What the hell are we going to talk about? I have no idea what to say. Nothing. I have no idea. Tune in to this episode of Health
Hang on, Jess.
Yeah?
It's late at night. Look out the window.
Okay. It's early in the morning here.
Okay, so you're in the future.
I am in the future. That's why everything's so white and glossy here.
From the future to us in the past.
That's right. On this episode of Health In 2.00. So I've come from the future. Woo!
Yeah, you're still in the future. You're just reporting back to us in the past.
Yeah. Well, I'll tell you
any
what.
stock tips?
No. The Australian market crashed. There's nothing to say.
Yeah, everyone else's market crashed too, thanks to fine president and its trade war. Livongo stock is down again, but it's still above its IPO. So, you know.
Well, there we go. There's our IPO news.
IPO news. And surprisingly, Frasier stayed pretty high. So,
hey, who knows?
But yeah, we need some new IPOs. Where are you? American Well, 23andMe. Come on, guys. It's been weeks.
Somebody.
Having said that, I think when we get to the 2 minutes, you'll have something that's effectively an IPO. So
basically. Okay. All right, do you have your timer ready?
My timer is ready.
Okay. Ready? Here we go. 3, 2, 1. All right, so basically an IPO. Babylon raises $550 million. The largest ever digital health raise brings their valuation to about $2 billion. What do you think? What did they do again?
Okay, so this is big and complex. So it starts, the layer is a AI-based doctor that is in your pocket that is telling you what happened. Telling you it's a symptom checker and telling you what to do, and it distributes where you go. So that's a good start. In the UK, they're working with primary care doctors. In China, they're working with insurance companies, and they're doing some other stuff across the world in different places. And part of this round, now most of this money came from the Saudis and the Russians and Kinevec, the Swedes who made all the money out of Livongo, but part of this round, 50 million allegedly came from Centene, a big Medicaid plan. Yeah. And that probably gives you some ideas about where they're heading in the US. Can they get this kind of tool in the hands of ordinary people in order to redirect them around the care system in a more effective, efficacious way? Lots of controversy about Babylon, but that's the big idea. And at least the Saudis and others have put their money where their mouths are.
Yeah, lots of money. All right, a little bit of money. $3.8 million goes to MetaMe, which is a hypnosis-based digital therapeutic for IBS. There's like a lot happening in this IBS space.
Yeah, well, that was Avanti Health last week, raised some money. There's those guys, Oshi, who were Venture Connect and are kicking around. And didn't you talk to one of these guys?
Yeah, I did. Bolt Health. So people just getting into this because it's easy.
Well, I think it's not easy. I mean, it's a very complex syndrome, right? You know, irritable bowel syndrome, irritable bowel disease, Crohn's colitis, all that stuff. Bad news. MetaMe, a guy called Dan Burstein, who's been a health 2.0 guy forever, is one of the founders there. So good luck to them. Next.
All right, CVS CarePass. So I guess the pilot is passed. They rolled out in Boston, and now they're taking this nationwide. So this is supposed to compete with Amazon Prime. Do you think they have a shot? Okay, CVS CarePass, nationwide, Amazon Prime competitor for CVS. So CVS is doing a lot of stuff, right? It's also got telehealth effort. It's got its new in-store clinics and stuff. It's going to do, you know, they and Walgreens are obviously trying to get out ahead of Amazon as quickly as possible. So, you know, good luck to them because Amazon Prime's got kind of a stranglehold on the US consumer, especially the more affluent one. But CVS, you know, and Walgreens get visited by a lot of people. There's a lot of foot traffic there. So we'll see how this all plays out. One thing that I think was kind of ironic is that Aetna, which CVS bought, last year, earlier this year, I don't know when it actually closed, they had their own thing called CarePass, which debuted at Health 2.0 back in 2012, 2013, which is Mark Bertolini and then Martha Wathard putting together kind of a consumer level platform to put apps on. It was going to be the next big thing. And then, of course, you know, 15 minutes later, they got rid of that. And then Medicity, which is the other big thing they bought for $500 million, was sold to Health Catalyst, who went public and IPO'd last week, 2 weeks ago when it was, for like $4 million. So What happened to Netflix past? At least the name is coming back.
Hey, everything old is new again.
Well,
Right.
there's only so many things you can call things, right? And care and
Yeah, no,
past and
I don't
something.
know. This is interesting to me because they said that, I mean, it's like prescription drug delivery and you get like $10 in your CVS CarePass account to spend on stuff. So they were like, I guess their uptick of use was in the millennial age bracket, which I don't usually think of as CVS customers. So that's pretty cool. We'll see what happens.
Well, maybe those millennials will get sick soon. Who knows?
Let's hope so. No, I'm joking. All right. Well, thank you for weighing in with your insight on all of those things,
I'm
Matthew.
not sure I have much insight about that CarePass, but we'll go on.
Well, I mean, the fact that the name came back is just one of those great little tidbits that I'm sure our viewers love to hear from you. So if you out there have any questions for us, I'd like to point out that we are fast approaching our 100th episode. So in order to make this thing a 100th episode extravaganza, I want to make sure that if you have questions or if you have requests, you send them in to us so that we can wrap them in to this big celebration.
We should think of some
Hopefully
guest
at
stars.
Health 2.0.
We're going to do it there? We should think of some guest
I don't
stars.
know. It's going to time out real close. We'll have to see.
We'll probably have to fake it. Have to fake it till we make it.
Well, what else is new? What have the last 90 episodes been? Anybody who's watching knows. All right, guys, you can get a hold of us. I'm at Jess Tomasa on Twitter. He is at Boy, of course. Make sure you subscribe to this YouTube channel because it's growing by leaps and bounds as we approach 100 episodes. Just search Health in 2.0, or you can subscribe to the Healthcare Blogs newsletter and receive episodes of this show and all the other great content from the blog directly in your inbox.
And by the time you see this, the Hardcore Health, our podcast, should be out, third one.
It should be, yes, our third podcast, because it's not enough that we're invading people's space in video. Now they can drive to work.
Why are you forcing anyone to watch? It's like it's the video games that Trump's always
I
going.
think everybody should be forced to watch. All those big health plans should be like playing continuously.
They have other issues. We'll get into that next week or maybe in the podcast.
We'll see. All right, guys. Well, thanks for joining us. Next time you talk to me, I will be at HISA's Health Informatics Conference down here in Australia. So you guys will get a peek at that. We'll hear what's going on in the digital health world down here, and we'll report back.
And
Matthew?
I'll be going on vacation to Lake Tahoe. Well, we may do one from Tahoe. Maybe I'll do one from the deck, from the mountain.
Nice.
We'll see.
We had one of those back in the day. All right, guys. Thanks so much for watching. I'm Jessica Devassa. That's Matthew Holtz. We'll see you soon on Health in 2.0.